The World Health Organization certified in May that the countries of Benin and Mali have eliminated trachoma as a public health problem, the fifth and sixth African countries to do so, as VOA's Kane Farabaugh reports. While the Carter Center is celebrating the milestone in Mali, its work in eliminating and eradicating trachoma in Ethiopia, Niger, South Sudan, and Sudan continues.
The leading cause of preventable blindness in the world. And
the Carter Center was already a decade into its fight against guinea worm globally, when former President Jimmy Carter and his global nonprofit took on another neglected tropical disease in the African nation of Mali. Kelly Callahan is the director of the Carter Center's Trachoma Control Program.
25 to 50% of the children between the ages of 1 and 9 in all areas of Mali suffered from the beginning stages of this disease.
It was a statistic Callahan says troubled Carter.
The Hilton Foundation asked President Carter and the Carter Center, would we be willing to consider working on sanitation and water to combat this disease called trachoma in Mali and Niger?
The Carter Center set a goal of eliminating the disease in both countries.
for eyes, no trichiasis.
Trachoma can be transmitted through infected discharge from the eyes and nose.
This disease is preventable. A bacterial infection that stems from access or lack of access to water and sanitation, poor living conditions, socioeconomically stressed populations.
Since 1998, the Carter Center and its partners have funded and staffed programs with host nations to develop strategies that both treat and prevent infections, even during Mali's recent armed conflict. The Carter Center believes its program in Mali has helped avert blindness in more than 5 million people, and the antibiotics used to combat trachoma also help prevent infant mortality.
The elimination of trachoma as a public health problem in Mali is no less than Herculean.
Sadi Musa, the Carter Center's senior representative in Mali, believes the success of his organization's trachoma program could boost efforts to combat other neglected tropical diseases like guinea worm.
This also will help us, with donors, to show them that we are serious in what we are doing, and we can convince them to get more resources.
While President Carter has retired from public life and is receiving hospice care at his home in Plains, Georgia, Callahan says they keep him up to date on recent developments in Mali.
And we heard that President Carter was just thrilled beyond belief. So we're very excited that he knows.
Callahan says while Mali's elimination milestone is important, the Carter Center's work in Africa is far from over.
We work in 5 countries, including Mali. Those 5 countries have the worst known trachoma in the world.
The World Health Organization says trachoma remains in 23 African countries, and approximately 105 million people on the continent live in areas at high risk for infection. Kane Farabaugh, VOA News.